Dr. Crail, I want to talk to you about a topic which I think is extremely super important, super neglected, and in most cases wrongly and neglectingly explained by dentists. But that's just my opinion. It's periodontal disease, gum disease, gingivitis, all of it the same, just, heavy periodontal disease is just heavier than a gingivitis. It's basically a bleeding and an infection of the gums. Now, here's what I hear most dentists say. If you don't fix it, you're going to lose your teeth. You're going to lose bones and eventually your teeth. Now, while this is a very bad thing, and it costs money to replace them and all that stuff, dentists do, however, a very good job in replacing teeth. There's implants, there's crowns, bridges, there are even great dentures out there, and implant-supported denture. We only need a couple implants and maybe 3, and then you put a denture on it. So it's actually relatively cheap to get a whole mouth with pretty goddamn good teeth. Now, the problem I see is that it lasts, I don't know, anything between a couple years to maybe even a decade till that will happen. Now, it's during that time where the gums are infected. It's like if you have a red, big infection on your hand, food, on your wherever, in your lungs for that much, anywhere where there's an infection, and it's at the gateway of your mouth. And while this is happening, a person is poisoning his body. It's the infection drips into the blood. It poisons the liver, the kidney, the heart, the blood. Babies are reported to be born underweight and premature because of it. All kinds of things. So wouldn't that be so much worse than losing the teeth? And why do people not pay attention? Why do dentists not insist that a person gets his gum fixed or else?
Well, we do encourage patients to take care of the gum disease, and we do encourage them to come in for regular hygiene visits, for treatment, for maintenance over time.
Let me interrupt you a little bit here. Let's go back here for a second. Let's, tell me with clear and no uncertain terms, yes or no or whatever, what I said. Is that true? Does gum disease have such bad effects? Does it bring down the immune system, which then in terms makes the person susceptible to get easier a cold or anything, and a swine flu, name it? And is the liver and the kidney possibly getting damaged? Is it easier to get for the person diabetes because of it? Is all that true?
Well, yes, in a general sense, yes. Specifically for any individual, it may or may not occur because studies, research has shown that there is a link, there is a connection between periodontal disease, inflammation in the gums, with those other problems, the cardiovascular disease, with diabetes, with kidney problems, and with problems in pregnancy. That's true. But for any one individual, it may or may not occur. But in a population where a study is done, yes, there's definitely an association there. There is something going on. We don't understand all the reasons and all the connections yet. Research is ongoing, but there's definite links there. And so as a result, we want to prevent as many problems as we can. So we encourage treatment if the disease is there, or prevention, so we don't have to treat the disease.
Well, okay. So first of all, I don't understand, in terms of like not understanding it, I'm not so sure that there's something of not understanding it. If a person has a major infection on his knee, on anywhere, he would run to a doctor right away, even if it's just small like a nickel. But the infection in a mouth is big like a hand. When there's an infection, the soldiers, the immune system soldiers, need to try to work on that, and obviously they don't have time for something else. It's like fighting 2 wars and then going involved in a 3rd one and possibly in a 4th one. That can't be good for the country, and it can't be good for the body. And in terms of that, certain things might not happen to a person. Obviously, depends on many things of his strength, but it does look to me he's playing Russian roulette.
Yes, when the body is fighting infection in one area, it takes away energy from another area. That's true. And the more things that the body has to deal with at one time, the more stressful it becomes for the immune system, the more susceptible they get to greater and deeper problems.
Right.
Many times,
go ahead.
Yes, many times the gum disease is what we call asymptomatic. The person is not aware of any pain, but yet they come in for a checkup, and my goodness, we see that over here they have a gum pocket, there's pus coming out. Oh, they never knew it. They just never felt anything. They never noticed anything. And this is what we do. This is what we find. And we let patients know what's going on so that they can deal with this and take care of these problems before they get any worse.
Right. Is it true that there is lately more and more over the last year or 2 or 3 years, whatever, that there's more and more surgeons, be it a guy who takes out appendix or who does a hip replacement or any other type of surgery in the body, that those surgeons more and more look at the mouth and say, get a clean bill of health from a dentist so that you to make sure you don't have a gum disease, because I don't want to cut you if there's any presence of gum disease, simply for what you just said. The body is now weak, and if any operation is an invasion into the body, no doubt about it, so is of course an infection. So basically you have already one infection going on, you want me to cut on another part, your body can only stand so much. Is that true, that this is happening with surgeons now more and more, and they're paying attention to it?
Right. The medical community is becoming more aware as the research develops, and as well as the dental community, we're more aware of the connection between the mouth and the rest of the body. So that's true. Problems down here affect problems up here. And so we need to have a more of a holistic whole body approach. And it's true, before someone, let's say that they needed a knee or a hip replacement, yes, very important to get the mouth clean and in excellent condition, because it does affect the rest.
Right. And obviously that should show every one of us that if it is so severe that we can have maybe premature born baby which are underweight, that infections can happen, that surgeons don't want to operate in a second area when there is this going on, that a person should simply fix it, because he's obviously predisposing himself to just the next swine flu, bird flu, never mind the swine flu, bird flu, just to the next flu season period, which for sure will come. Dr. Krajls, thank you very much. Very informative, and I hope that people listening to this video do fix their gum disease, because it just might be one of the areas where if we can do all the things we talked about, it probably makes the person tired, fatigued, and again lifeless, and it's just not worth it. I mean, nobody wants to run around with an infection. Never mind that probably if that happens, the person is trying to do all kinds of Listerine to get his bad breath out of the way, because he gotta be a little bit stinky in his mouth. Thank you very much, Dr. Krajl. Bye-bye.
Thank you. It's been a pleasure.